Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors, where true wealth is health. As always, we're going to go around our esteemed panel and we're going to do some great introductions. Before you ask, let me give you some updates. Dr. Miller is out of town this week, but he sends his regards and says that he can't wait to get back on next Monday. And Dr. Hampton is as well. So just want to give you guys a heads up about that. Dr. Mason and Dr. Pete should be joining us shortly. But we have a great guest on with us on tonight. And of course, we're going to go around that esteemed panel to my colleague who tends to leave me and go and have fun in the sun, but he's always right on time. That's our very own Dr. Douglas Graham. Dr. Graham.
Thank you, Nikki. I'm a retired physician. I was a specialist working in the western suburbs for about 30 years. After that, I joined the congressman in his office. It was a tremendous experience. It is a real honor and a pleasure to be here with one of my colleagues. I'm going to try and answer your questions as best I can.
Outstanding, and thank you so much. I want to say hey to Sister Bonnie, who's here with us. Sister Bonnie is here. She says good evening to all. To Judge Marianne Jackson, who is here with us, she says good evening to all. To the man who has the best art there is, he's the art connoisseur. That's our very own Joseph Harrington. Hey, Joe.
Hi, Nikki. Yeah, this is Joe Harrington. I've introduced myself every week for the last couple of years. But for those of you that have never met me or I haven't introduced myself to, I spent most of my career in healthcare and public health, worked at three different hospitals. First one was UIC. Then I went to Mount Sinai and then finished my hospital work at Rush. But I also worked at the city and state health departments, worked at the city three times, first as community mental health worker in North Lawndale, then worked for the city for about 10 years in the 80s, started out managing a hypertension program and wound up developing a chronic disease program and left as director of chronic disease. Then I left there, went to the state, worked there till 2017, retired, was the regional health officer for Cook County and an administrative law judge.
Outstanding, and thank you so very, very much to the doctor that's known on these streets as Dr. 100. She's an HIV specialist, but she gets the job done knowing that community health. That's our very own Dr. Maya. Dr. Maya.
Hi, thank you, Congressman. Thank you, Nikki, for inviting me to this space. Always a joy to connect with community and build culture and talk about how we can keep it healthy while keeping it 100.
Outstanding. I want to say hey to Yolanda Williams that's here with us. She says, good evening to all. To the urologist of the stars who hates accolades, but he is simply fantastic. That's our very own Dr. Terry Mason. Dr. Mason?
Good evening, Nikki, and thank you and the Congressman for having this forum. I'm always grateful to be here with my colleagues, and I'm hopeful that today we will be able to continue to enrich the knowledge base of the people that we serve in ways that can help them have better lives.
There we go. Outstanding, and thank you so very much. Well, to the man who makes this. Oh, well, right before I do that, want to say hey to our guest that's here on tonight. We have a fantastic guest that's hanging out with us on this evening. She's the chief emergency room physician at one of our local hospitals. So when you are rolled in by that ambulance, she's the person who takes care of you. And guess what? Her favorite food is collard greens. I wonder if she can cook those. Go right ahead. Why don't you introduce yourself, Kim?
Hi, Nikki. Thank you and Congressman Davis for having me on. My name is Dr. Kimberly Briggs. I do work at one of the community hospitals on the west side as the chair of emergency medicine. I am family medicine trained by residency. However, I was a nurse first, and I worked in the emergency room for years. Probably 2000. Yeah, 2000. I've actually written a manual on standards of practice in emergency medicine as well. Uh, I have, I love to travel. I love communicating with my patients in the ER and just giving them more of an understanding of, what the ER is for and what their primary medicine doctor is for as well. So glad to be here, glad to share things with the community, and I hope something I can say will help.
Outstanding, and thank you so very much. Well, I know he's here, but I think he's muted. I'm unsure if he can hear me. But Dr. Pete, are you available, or did you put us
Hey
on hold?
Nikki. Hey Nikki.
Yes,
Um,
Dr. Pete, who is our physician by day and DJ by night. Go right ahead.
hey, I just want to thank you and the congressman for creating this forum. Happy to be with my colleagues. Happy to have a conversation about health and how we can move the needle to improve health status and reduce health disparities. Happy to be here.
Outstanding, and thank you so much. He's maybe having a few tech problems, but I know once he gets everything done, then you'll be able to view him. Connie Taylor is here, and she says good evening to everyone. Alderman Pat Dow is here, and she's saying good evening, and she's excited. Want to say hey to Audrey Jaycox, who is here with us. Also want to say hey to Commissioner Donna Miller, who is here, and also President Carrie Steele, who is here with us. Donald Dew is here just as well. I want to say hey to Donald and Tarina Newkirk from NAACP, along with the president, that's Carl Brinson. They are here with us just as well. Pastor Cy Fields is here with us on this evening. Say, hey, Pastor Fields, and thank you for hanging out with us on Couch Conversations with the Doctors on a great Monday night. To the man who makes it possible for us to do this each and every Monday night, to the one who teaches us that true wealth is health, that's the Congressman of the Illinois 7th Congressional District, Danny K. Davis. Congressman?
Well, I've learned where collard greens get green from. I was listening to Dr. Mason on Sunday, and he was explaining how the rainbows and how greens get their color and how purple whole peas become purple. It was the most amazing discussion I had heard on a Sunday morning. And it was just fabulous, out of sight. I enjoyed it almost. I almost didn't go to church. I say, I've heard some celestial health activity, but it's good to see everybody. Thank you all. It is amazing. Joe, did you work with Dr. Lucy Chappelle?
I was a community mental health worker in the early 70s at Lawndale Mental Health Center, and Lucy Chappelle was
North
the director.
Lawndale Mental Health Center. Well, I wanted to just mention that in terms of knowing that Lucy just passed and her services were over the past week. And she and her husband were both tremendous assets to the community. Her husband, Roy, was at one time the head of the Tuskegee Airmen in Chicago, and their family contributed greatly. So I just wanted to mention that Lucy not only ran the Lawndale Mental Health Center while it existed, but then she came over after Bobby Wright passed, and she ran the Bobby Wright Mental Health Center for many years. But she also built 40 units of housing for people who were developmentally disabled. And she was just a great asset, especially to the mental health community. Um, Joe, as I listen to you talk about all the different places that you worked and all the different places that you have been, um, it was just amazing how expansive your work experience, engagement experience, and all of that has existed, and how some of it we need to clone and see if we could create another Joe Harrington, because you and your sister, I always say, have made tremendous contributions to the community that you are indeed a part of. So being an elected person or a public person just gives me the opportunity to meet and know all of these people that I have met and have known. And I wish I could just stop doing other work and maybe write books or something and pass on some of all the knowledge and information and feelings and contributions that people have made. So thank you for spending Mondays with us. And why don't we get it on, Nick?
Well, Danny, before we get started, I just want to thank you for the kind words. We've known each other for quite a while. And I will call my sister tonight, and she'll be happy to hear that you mentioned her and gave her high praise.
Well, both of you, thank you.
Outstanding. Want to say hey to Ladarius Curtis and Aisha Jaco of Westside United, who is here with us on this evening. Hey guys, how are you? Nisi is here. That's Nisi Williams. Janicia, she's hanging out with us tonight on Couch Conversations. Want to say hey to Mimi Bray Boy, who is here with us just as well. So hey Mimi, how are you? Trina Johnson is here. Hey Trina, thanks for stopping by Couch Conversations. To Karen Scott, that's Professor Karen Scott. She's here with us just as well. And Teonia Spriggs say that their class from Malcolm X is watching. So, hey, class, how are you? Want to say hey to all of our great friends who's over at the Core Center who is working, who said the last couple weeks I didn't mention that they was here. So, hey, Core Center, because they are here and they want everybody to know that they are here. I want to say hey to Brad Cummings. Hey, Brad from the Austin Voice newspaper. Brad is watching just as well with us on this evening. Hey, Brad, how are you? Sharon Grant is here just as well. And Sharon says, I am here. That's right, Sharon. Nellie Pernell King is here with us just as well. And she says, good evening to everybody. Katina says, Congressman Davis has a special way of recognizing others. His memory is amazing. Hey, Katrina, how are you? And thank you for stopping by. Well, of course, April is Minority Health Month, and we've had some great programs throughout this month that we've seen a lot of our community members say, hey, Maureen is here. That's Maureen Robinson. And she says hello just as well. She's here hanging out with us. Hey, how are you? So we've had some amazing conversations throughout this month. We had some great conversations. I want to say thank you to the NAACP for partnering with us just as well on our maternal mortality week. And we had great videos and movies that we showed. But, you know, maternal health to us is not just a month. It is really 365 days of the year. We're going to continue some of our maternal health conversation on tonight. And one thing that Pete and I use, Dr. Pete, that is, and I began this conversation with before we even knew what COVID was, and we started that conversation, we also talked about having a great relationship with your physician and not using our emergency rooms and our urgent care centers as your primary care physician. Well, Dr. Briggs, what do you say about that? What happens when our patients tend to use the emergency rooms and or urgent cares as their primary care physician?
So, for those of you who do not know or not familiar with, or are not familiar with the healthcare system and how things are normally ran, your primary care physician is the one that is there from what we call cradle to the grave. Whether you started with them as a child or your pediatrician, sometimes they pretty much have your records. They have everything that is needing to go on. They have the screenings for when you need to have them. They have pretty much your whole entire file and what needs to happen. It's very important that we have that and also have our yearly health exams, because that kind of gives them an idea of how you're doing, if you need to change things, if something's going on with your diet, especially when you're getting past the age of 35, then past the age of 45, then past the age of 55, and especially past the age of 65. However, in minority communities, a lot of time access to care is very limited, and the education is not spent to teach patients in the emergency room. We wish we did have that time to do so, but it's so busy and everything is going on at once. And we pretty much have to prioritize each patient as who's my sickest patient. And that's just kind of how you run an ER. And whoever that sickest patient is, that's the one that you have to focus on. That 15 minutes that you have, or that 5 minutes that you have to do an assessment, can be limited even more if you have someone that is near mortality. So I really try to educate my patients when they come in and I see that they have a list going back 5, 10, 15 years of just emergency room visits, and there's no primary care, and they've been getting their medications filled in the ER. We do not manage. And what that means is we do not know if the medications that we have prescribed for you for that moment are actually helpful or detrimental. There's no way for us to see that because we're not following you. We do shift work, essentially. We're not into actually managing how well you're doing. If we need to alter something, that's the job of your primary care physician. We are a band aid. We are there to pretty much keep you from a, a detrimental event or dying, or just keep it 100 in that moment. Our goal is to keep you from dying in our ER. That's why we're there. And if you are not about to die in our ER, then we have to focus on the patient that is about to die in our ER, because we don't want anyone dying in our ER. It affects us. It affects our day. It affects everything. We have to go home with that. It's so we have to spend time to ensure that we're doing everything that we can for those patients that are really sick. Unfortunately, it seems that people have the idea that emergency room means that whatever's emergent to them, then they need to come to the emergency room. That's not the case. Emergency room does not mean your emergency. Emergency room means emergency for someone that is actually in the level of an emergency. And that goes from 1 to 5, meaning it's non urgent, it's acute, it's semi urgent, to emergent. If you are not in that level, then we have to focus on those patients that are. That's on our side. On your side, it's detrimental because you're not getting the best care. There's been studies that have shown, for example, that the most overlooked patient in an ER is a Black female with abdominal pain. And we get Black females with abdominal pain quite often. One of the quickest fixes and one of the main causes of ulcers or gastritis in Black females is H. pylori, or alcohol use. Uh, H. pylori is not something we can test in an emergency room. It's just not something we would do. You have to wait for those tests to come back. Anything that we have to test and wait days to come back, it's not a great place to do in the ER, and we don't even order those tests. So you're going to come in and we're going to give you proton pump inhibitors, or what we call protonics, or omeprazole, or Pepsid, or something of that nature, and we're going to get you okay for that moment. That's a band-aid. That does, and we're going to tell you to follow with your primary physician, and usually people don't, and they come back once things have gotten bad again, and now we're back at the same place. We have not healed that problem. In the meantime, you are causing more damage because that ulcer is worsening. And now it's to a point where now you may have to have some type of surgery, or you may have an ulcer that is actually causing damage to the tissues and the cells, and now you're developing some type of carcinoma that you didn't have to have, because no one tested you for the H. pylori that you could have taken meds for 14 days and been done with it. uh it's really important for us to stress that to our patients. Unfortunately, when you're one physician and you have 30 patients that you've got to see and prioritize all of them, a lot of times we don't have the time. I try to do it as much as I can because I am family medicine trained, so I am taught in management. But most of the ER physicians that I work with who are emergency medicine trained, they know nothing about management. And I don't fault them for it, and I don't get on them for it. The internal medicine doctors get upset about it, but that's not what they're there for. That's not what they were trained for. So I just want the community to be more cognizant or more aware that your primary care doctor is the most important physician that you can see. We are definitely there for those acute issues that happen and things that you weren't expecting, or emergencies that come up. I cut my wrist, mom, someone's having a heart attack or something like that. Please come. We want you. We want to be sure that you are safe. We want to be, even if it's just a concern. But if it's a chronic condition, or something that you're continuously having problems with, your primary care doctor is that person for you.
If I could add some context, a little more context to this,
Mhm.
since I'm an old guy, and I can remember, because see, things changed in the time that I was came into medicine and practiced, and so things changed. So just to give some context for the city of Chicago, we used to have a number of places where we had primary care doctors, and places like the Williams Clinic, places like where I had a number of people at places like the center right there, 30 Medical Associates at 3233 South King Drive. There were a number of places where people could go, even in some of the hospitals or clinics. People did have primary care doctors. And then what happened? Things changed in the way people got trained. And we didn't see there was a change, a shift. And what happened, and I can also say that if you look at some of those facilities, a lot of those facilities are gone now. And if you look at a lot of the physicians are gone. They're dead, or they have moved on, but many of them have passed on. And we have not replaced any of those docs. We've not replaced them. And we used to have our own clinics in our community, and we haven't had those. Thank God for the FQHCs and others that have taken some of those places, but there's a reason why this has happened, and that's what I wanted to sort of put more context around. That people would go to that in those days when I grew up, and we had to go to the doctor. We went over to Williams Clinic, and you saw somebody over there, or 200 East 75th Street, or any number of those places. So that I think we need to also make sure that people understand that things changed. The way doctors got trained changed. The way they categorize things changed over time. So I'm sorry I didn't want to take a lot of time, but I felt the need to recontextualize this since I'm one of the old guys here.
Well, Terry, I think we're about the same age, so I can remember those clinics too. And there were clinics throughout the community, and there was some physicians that actually had private practice in their homes. Some people used to go to a doctor's house. The first dentist I saw, his office was in his house. And so things have changed markedly. And it opens up the door to talk about two things. One is, I look quickly, it was March 10th, 2010. The Affordable Care Act became law. March 10th, 2010, called Obamacare at the time, but that was for political reasons. And what happened, it increased access to healthcare to a lot of people. But there are a lot of people that never took advantage. And still today, there are a lot of people that never took advantage of the Affordable Care Act. And so it gave people more access. But what we haven't really seen and what we're talking about is utilization. Do people come? Do people take advantages of the services that are available to them? So the problem is a lot of people don't even take advantage of the services that are there. If they're low cost, no cost, or whatever, they don't take advantage of those services. And a good friend of Dr. Mason's is that Dr. Paul Crawford. He used to talk about what he called the I feel good syndrome. And that is that when people don't feel an ache or pain or symptom, they assume that they are healthy, and they're waiting for some sign to tell them that there's something they need to see a doctor about. If you're waiting for a sign, that sign might come as a stroke, a heart attack, kidney failure. It could be any number of things that happen because you waited because you felt good and you didn't see a doctor. So I think the message we're all saying is that everyone should take advantages of the programs that are available, the clinics that are available, and find a doctor that they can feel comfortable with, and most importantly, they can communicate with.
Yeah, I mean, we saw what happened in COVID as an example, but let's take Dr. Briggs as an example. I love that example, and think about why it's important to make sure our community, our tribe, which includes us, stays out of the hospital, right? While Dr. Briggs is there and she's wonderful, I don't want you to have to go see her, because if you're looking at Dr. Briggs, it's a problem, And so I want to be your health bestie, and I want to talk about preventive care, right? There are 3 levels of preventive care. I posted like a little cute chart for those of us that like to look at pictures. There's primary prevention, secondary prevention, tertiary prevention. Now, if I'm talking about H. pylori, Dr. Briggs already told you, if you come in there for tertiary prevention and you are of the African diaspora and you're a woman, but that goes for our African men and others of the African diasporas too, you're going to be overlooked. That's why I want you to just stay out of there. Stay out of there. That's not the place for us, okay? So primary prevention is everything we're going to do to make sure you never end up like healthy nutrition, healthy activity, things like that. I'm going to make sure you don't get, let's use H. pylori, AL, or diabetes. Let's use diabetes. I'm going to, stay active, eat the right things like that. That's primary prevention. Don't even go there. We're not even going there. That's what primary prevention means. Secondary prevention, I'm going to screen everybody who I think would qualify for it. So if I'm talking about diabetes, for example, you go every 6 months, you go every year, whatever your healthcare besties recommendation is, which is the primary care, right? And, in layman's terms, Dr. Briggs just said, I'm going to be your Dr. Maya is going to be your healthcare bestie. Dr. Briggs is the one I'm calling for backup. We only backup only. So secondary prevention is everything I need. I'm going to screen everybody. If you have diabetes, we're going to do nutrition, activity, maybe, medication if we can't control it with nutrition and activity. That's secondary prevention. Tertiary prevention, we missed our opportunity for primary, right? Healthy activity, nutrition up front, all these other things that we did to keep you from getting diabetes. We missed our opportunity right now for secondary prevention, which is we screened you. You went to your healthcare bestie, got screened, your primary care doctor you trust, got screened for diabetes. Oops, we caught it, right? And now we're managing the glucose level and getting something that works for you for the rest of your life, right? Now we're at tertiary prevention. Now we're rolling up on Dr. Briggs, and now she has to do tertiary prevention. Now, she already told you primary and secondary was not the forte in the emergency room because there are other people. Now we got tertiary prevention, means diabetes out of control in a coma, kidney failure. But guess what? Dr. Briggs is also dealing with somebody who, cholesterol was out or heart health was off. Now they having a heart attack. And there are other things. Someone got, in the middle of the street, accident, an accident happened. She's dealing with all of that. She's not thinking about H. pylori in the stomach, And so she's doing all that. So just come see me. Let me be your healthcare bestie. Do the primary prevention thing. And then we'll all just see Dr. Briggs on Couch Conversations. Yeah.
Maya, I'm going to add another level of prevention. You may or may not have heard. Have you ever heard of primordial prevention?
No, tell me.
Primordial prevention is the prevention of risk factors. I'll give you some examples. One is, and a lot of women don't really understand or know this, but breastfeeding is a way to help produce healthy babies. And it's one way to get nutrition. It's another way to, make sure you have healthy babies. And more women now use formula so they don't breastfeed because it's inconvenient. But that is a way to reduce the risk that an infant child might possibly get a disease. Another one, and this is pretty simple, just wearing a seatbelt in a car.
Mm-hmm.
That presents the risk factor. If you were in an accident, maybe you'll survive the accident. And so there are a lot of things that can be done. And that gets back to the thing we talk about a lot of times in public health, the social determinants of health. And sometimes we also say your zip code is more important than your genetic code in determining your health outcomes. You can't change your genetics. You can change your zip code. You can move from neighborhood to neighborhood. But if you move from one poor neighborhood to another poor neighborhood, you're probably going to have the same outcomes regardless. Less access to health care, less access to healthy foods, a plethora of things, more exposure to violence. And so that has a bearing on your health as well. So there are a lot of things that actually contribute to the conditions that we see. And the last thing, and I'll give a personal example because I thought about this years ago, and I love to play basketball. I was hit, but it was an accident. I got a cut over my left eye. It required 13 stitches. I went home from the gym. I couldn't stop the bleeding. I was at home for like 30 minutes and the blood kept, no matter what I did, no matter how much pressure I put on it, I couldn't stop the bleeding. So I decided, I think I'm gonna go to University of Chicago emergency room. This was probably close to 10 o'clock at night. I didn't leave till 4 a.m. The first thing they did is they stopped the bleeding. So I wasn't bleeding anymore. Then they put me in a room. They put me in a room with nothing. I was just in a room by myself until a surgeon could come and stitch up the wound. So the surgeon came, stitched up the wound. As soon as the surgeon stitched up the wound, I could leave. You know, but an emergency room, and it says it is for emergencies, medical emergencies, life-saving emergencies. That's where people with heart attacks and strokes go. That's where people that get shot go. They take them to the emergency room, and that's the primary focus of people in the emergency room. Everything else is collateral. And if you ever go to the emergency room, you'll see people coughing. You'll see people just sitting there waiting that don't have a major issue, particularly one that's life threatening. So it's the last place to go if you need urgent care as opposed to emergency care.
I just wanted to add one more thing because it came to me after I finished, and I'll be very brief. One of the other things we have to remember was the change in medicine. Medicine became a corporate entity, and it was
Mm-hmm.
corporatization of medicine that changed those things that we just talked, some of the things we just talked about. And when I can remember, particularly when the HMOs got started, and when doctors see, nowadays most doctors don't have their own individual offices.
Right.
If they do, they're part of either some sort of network. And I want to also give a shout out to Congressman Davis, because if it wasn't for some of the federally qualified health centers that were in these communities, there'd be even less than there is today. So at least with the federally qualified health centers, people can get and can establish a relationship with a primary care doctor, can have a clinic that's in their neighborhood for the most part, and could usually provide them access sooner than later. But the one thing I wanted to make sure is that I grew up, and since I'm older than most of y'all, maybe not a couple folks, but I grew up at a time when we went from there being that family doctor that you could go to, and that was located in our community. And I could name lots of them that were down on the south end, on the south side. Those that were down in the middle, around where Michael Reese was, and people don't even know what Michael Reese was, or is, or used to be. But there were a lot of things, and then doctors had their own practices. But what happened? They got to the point where a doctor could not afford to be in practice, because when you had to buy the malpractice and all the other stuff that went along with it, you could not afford to do that in the way that we used to practice medicine. So that was one of the reasons why we had to come up with things like federally qualified health centers. And then you begin to see doctors groups, and doctors were grouped as a corporation because it was too expensive. And right now, nobody goes out necessarily on their own and sets up a private office, because it's very expensive. I'm not saying no one does it, but it's expensive. And when you have to pay your malpractice and you've got to cover all the overhead of an office, it's very, very expensive. And that's one of the reasons why you don't see that like you used to see. And because we didn't have that access, We then start going to the emergency room as our primary care entry point. That's why that happened. It was part of the corporatization of medicine that created that.
Oh, wow. Well, we can always get a great history lesson with Dr. Mason. Dr. Mason, a light bulb went off. We need to create a center of doctors who look like some of us here to help people stop using those emergency rooms as their primary care physicians. We had a outstanding conversation the other week about who do we trust and those doctors that we are trusting. And those questions are still rolling in. Well, Deborah Cozy Lane is here and she says, keep up the good work. We need this information. Yolanda Williams says the lack of knowledge in our communities believe that they go to the emergency room and they get all the tests that they need and they find out what's wrong. It takes a long time to get a specialist appointment, so they go to the ER or urgent care because they think they can get all of their x-rays there. That's interesting to know. Well, Melanie is here with us, and I know that all her friends at Cook County, even though they are working in the neonatal department, there's a group of them watching too, but they're working at the same time. And Melanie says, thank you all for your health and knowledge and the care for our community. Yolanda also says we need more PCPs that look like us. It's hard to find a PCC in an appointment, and it takes so long to get them. We got to do some work on that. Jack Lynch is here. That's right, Jack Lynch. He says, good evening, team. Joe Dean is here. He says, good evening to the elders. Yeah, it is rough in those emergency rooms. Terry, who is Katrina, is Katrina is here, and she says, I appreciate that all of you are representing the positive side of healthcare in our communities. Unfortunately, the real experience for some patients is not positive. I had a primary care physician, and I had to have a okay. So I think this is she had to have her kidney removed. A nephrectomy, I believe. I know. Nephrectomy. Okay. I need to leave one of those consonants out. She had a nephrectomy about 7 years ago. And I was told that I had chronic kidney disease and that this is something common in African American women over the age of 40. And because I was overweight, it turned out that I had kidney cancer. And I am prayerful that I found a physician who was non-biased about my weight. It should not. And I think it cut her off because it only takes so many characters. But Terry, type in the rest that you want to say because it does cut you off because we are limited on the characters. But I'm actually excited that you found a doctor who was able to aid you in that diagnosis and get you to the point where you are today, which is alive and well and being able to share here with us. Jodine says, I went to the emergency room and I am glad it saved my life. Outstanding. Well, that's what it is. ER, emergency. Well, Congressman, what are you thinking of this conversation?
Oh, I think it's just an enhancement of all the things that we need to know and all of the things that we learn. Something that kind of perplexes me a bit is oftentimes when I go to clinic, I don't see as many people as I expect to see. And especially given the fact that every week I go to funerals. Uh, I don't think a week goes by that I don't attend at least one, many times two, other times three funerals. Um, I did 4 one Saturday. Um, and so the life expectancy or the fact that people are still transitioning, are moving. And of course, some of these are at ages where one would expect to go, but many are not. Many are young people who were not expected to go. So, how do we convince people to pay more attention just to their own individualized health? How do we get people to do that?
I wanted to add to that because that's a very very good question. I think that's one of the purposes for the conversation. What Dr. Mason said is very important, that we realize that the face of medicine has changed, and the more we educate people on that it's not the old standard that we once had when our doctors were in our neighborhood and we could go to their houses, as Mr. Harrington, excuse me, has said. It's a different culture now of medicine, and we have to respect that, understand it, and then utilize it in the way that it's now being given. And Congressman Davis, you have a very valid point, because we do have a lot of younger people that are coming in with illnesses that you see normally in 60-year-olds. I've had 30-year-olds that have dissections, and when you ask them about their health care, they haven't seen a doctor since they were a child. And everything that was going on, and I'm asking them different questions, and you're finding out that they have had those warning signals. They have had things that have happened, but they were afraid of coming to the doctor. They were afraid that something might be wrong. So it gets to the point where they can no longer wait, and the pain is too bad, that's when they come. We have to be able to have conversations so that we can explain, you can't wait. Just because you're 30 does not mean that you can't die of a illness that can be more chronic, but now it's acute for you. And our primary doctors are doing a great job at that. I wish that our doctors could have more time to do that. I do it as much as I can. My counterparts, however, it's really up to the individual person and how much time they can spend. But sometimes I have to grab a chair and I have to sit there and I have to explain to them, listen, if you are going to use the as your doctor, you are going to die to your own detriment, because we cannot do anything to prevent something once you brought it to us and it's already past that point. So the conversations must be had. We our primary doctors have to also take a part in that when they do see the patients, to explain to them, I want you to call me, or I want you to come in before you have a trip to the unless it's emergent. Explain to them what an emergency is. And our churches, our hospitals, whatever larger community groups that we have, is something that we need to have conversations about. And we need to educate people, because a lot of people just don't understand and they don't know. And most of that is because things have changed.
So I kind of had a thought as I've heard all this, is that if you look at doctors on television, they're doctors and they're acute illness doctors. All the models that we see, like House and Royal Pains, Chicago, that's how some people understand medicine. I'm kind of wondering that at some part of our public education, junior high school or high school, we should start having that dialogue and that discussion about healthcare and the problems that you may face as an adult, and how to enter the healthcare system and establish a relationship with a primary care doctor.
Like, I remember the days that would have been real easy. My pediatricians or my children were for Dr. Zoller and Dr. Adams. Dr. Zoller has gone on, and Dr. Adams is also retired now. But those relationships with those doctors were passed down from generation to generation many times, because many of those doctors stayed in those practices for long periods of time. It's gone now. It's gone. And with the corporatization of medicine, in other words, now the docs used to be their own bosses. Now they're not. Now the doctors work for different companies, and those companies put out certain kinds of rules, put out certain types of quotas in terms of numbers of patients that have to be seen in particular points in time. And it's a very different thing. And I don't want to make it seem like the doctors are the ones in trouble. No, when we allowed the corporatization medicine to happen, and there were a number of reasons, and we started with HMOs, which were the first way of beginning to restrict care, because with an HMO, yeah, you had to get in and see your primary care doctor, wait to get a referral, and so on and so forth. So there's a lot, and this is a much bigger conversation than we can have tonight on this show, because and then the other thing is that the publicity. I mean, what's happening with television, with what they're putting on television as all these medicines that you can get for this or take this or take that. And many people don't understand what these some of these things are, and some of them may even be harmful. And then I can't stop without saying we're eating worse than we ever used to eat. And the diseases that we're having, the cardiovascular disease, the strokes, and at least a third of the cancers are all diet related. And that's not changing because our diets are getting worse. They're not getting better. And I'm afraid for our children in terms of what's going to be happening with them. I never saw obese kids when I was growing up. Never. And I'll leave it at that.
Yeah,
Well, you
I
go.
want to make, and I'll try to be real brief.
Sure.
We have to start. We have to start where we are. The situation we're talking about is the way things are now. We've made a good argument and talked to people about how we got to where we are today. But I think what we want to do is a couple of other things. We want to empower people because they do have power within themselves to make a change and to change their lives moving forward. There was a program that the American Heart Association, the American Cancer Society, and the American Diabetes Association developed over 20 years ago. It had a simple name which applies to what we're talking about: everyday choices. The choices you make every day ultimately impact your health. Now, some people don't have the same variety of choice that other people do, but you do have choices. And we would be encouraging you to make the right choices in terms of what you choose to eat. And you have a lot of options. Try to do a good job of being healthy about moving, being physically active to the extent you can, wherever you are. Things like that will help you avoid disease. As Dr. Mason pointed out, we now have children, young children, that are being treated for diabetes and hypertension. That was unheard of. And that's because they're not making their choices. Other people are making some choices and decisions for them. And they are the victims of those bad choices. So, what I want to say is each of you have the power to change. If you're listening to what we say, you can take some degree of control. If you're smoking, you need to stop immediately because that's going to increase your risk for mortality. If you're not eating a healthy diet, and I'm not going to tell you what a healthy diet is, then that's going to increase your risk of premature morbidity, which means you're going to die early. And if you're not moving, I'm not talking about if you're not moving, because I know people and I have friends that don't move and they tell me about it. I had a friend I was talking to that I grew up with, and he told me he was having trouble walking. He doesn't walk anymore. He just sits in front of television all day. That's going to become a chronic condition at some point, So you have the power within you to change. And I think that's an important message that we need to give everybody. Take control of your life, take control of your health.
Outstanding. Well, Judge David Kelly is here and he says good evening. John Reed is here and he says good evening. Lori Rupert is here. She says good evening. Just as well, want to say hey to the firehouse. Lieutenant Greg Botts is here and he says they're all sitting around the couch watching. As always, outstanding. Thank you guys so much. Yolanda says, Dr. Mason speaks the truth. We never thought about expenses or the providers. Maybe the government can subsidize private practices. It seems private physicians. It seems like we are part of corruption. They tell you they got 10 minutes with the patient and you automatically are putting your gown on. Well, I wonder, do you have enough time to put your gown on, especially if you're a woman? We got to come out of a couple things to put the gown on. So I don't know if 10 minutes is going to do. Jodine says, Danny Davis, I appreciate you, Elder. I appreciate you. Also, Second Chance, Kind of Love says true. Hey, Commissioner Deer, how are you? Commissioner Dennis Deer says more education around food is medicine. Dr. Terry Mason started this a long time ago. We need more public education around it. I have picked up that mantle at the county. Outstanding. Well, you got to make sure that you go by Dr. Mason's God's Pharmacy, and that's pharmacy with an F, not pharmacy with a P. It's God's Pharmacy. Audrey Jaycock says that our diets were better because we had to eat at home and not all the fast foods. But again, I'm old. Well, it's not about being old because Dr. Mason gave us a whole lesson one day about what is cereal. And I am just still perplexed over what cereal is. Well, Mavis is here with us and she says, you are so right, Dr. Mason. They are pushing medicine more than encouraging better choices for a healthy lifestyle. I also have two questions that are anonymous. Well, one is not a question, it's a statement. It says, I love the analogy from Saturday. And Congressman, thank you so very much for Saturday at Loretta. It was simply outstanding. I was watching virtually because I couldn't get there, but it does look like sick care. We need to push for more preventive medicine. Also, we have a question that says, I am afraid to go to the doctor now. I went to my primary care physician and I was introduced to an AI doctor. This is something I am not going to stand for. I went in and I had to stand on a metal piece where it took my blood pressure and temperature. It also wanted to scan my body. I got off and I called my doctor and said I would not be back. Is this something that we would have to deal with? Well, doctors, P, Maya, Terry, Doug, Kim, are we going to have an AI doctor?
I think that you're going to be seeing it. And the reason why I think you're going to be seeing it is we have a tremendous workforce crisis to respond to. I don't think that we're going to be able to produce enough physicians, enough nurse practitioners, and physician's assistants to meet the demand. And AI clearly has everyone's attention. There's going to be money in developing these systems. I think that I can, from my perspective, I can easily see it happening. The other issue about this is that they may be more consistent. So there are advantages and disadvantages to this. They may not of the patients that's coming in. And so they need a disciplined approach on a regular basis, differently than other physicians. So I think, unfortunately, we're seeing it coming down the pipeline. All we can do is guide it. I don't think we can stop it or slow it down.
Okay. Well, Pete, I know you unmuted to say something.
No, I think Doug hit it on the head. I think, unfortunately or fortunately, depending on how you want to look at it, that technology is a part of assisting us to take care of patients better. I do think there needs to be some guidelines, particularly in healthcare, as to how not to go too quickly. Like even telehealth right now, it was unheard of prior to the pandemic. I wouldn't say it didn't exist. It did exist, but in order
Somebody
to
needs to
take care
mute
of
their phone.
in,
I'm going to ask if you're not speaking, could you please mute because we're getting a lot of feedback and can't understand everything that Pete is saying. Dr. Pete is saying.
yeah. So technology allowed us to have telehealth. So I don't think it's a situation where we say, we should not have AI. If AI can be, because machine learning is AI. So I can tell you, when we're taking care of patients in a primary care setting and it says, oh, this person is a diabetic, make sure they're on an ACE inhibitor. That's a pop-up screen, right? The ACE inhibitor is a particular medication that helps to slow the progression of kidney disease in diabetics. So that's machine learning. That is AI. Should we have that? I would say yes. Should the AI person tell me what I should do? No. So I do think it's something that will happen. I think there should be a significant amount of oversight, particularly from the Office of National Coordinator Office, which our good friend here who used to work with me in Cook County, Dr. Thomas Mason, who is the namesake of Dr. Terry Mason, works in the ONC now. And part of his job is to make sure that healthcare companies are, and particularly EMRs, the electronic health record systems, are they have what I would call rules of engagement for artificial intelligence. So there should be rules of engagement where, again, it's a tool to be used to take care of patients better, not a tool to independently suggest treatment regimes for patients.
Yeah, I want to say it's not a matter of if, it's also not a matter of when, because AI already exists. It's already being used in medicine. There was a study which I shared with some of my colleagues. There was in Medscape. It's something I look at all the time online. That provides a lot of information about health and public health. And there was an article in the Annals of Internal Medicine that said AI made correct diagnosis in 97% of cases compared to physicians 87%. So AI is on the horizon. It's something that exists. It's a tool. The concern is who's going to program the AI? And do we have people like us that are going to make sure that the program works for all people, or does it just work with some people based upon different socio-demographics and cultural factors? So that's the real challenge moving forward. Will it work for everybody the same, or only work for the majority of people in this country? So the genie's
Hi.
out of the box.
Mhm.
Go ahead, Dr.
I
Meyer.
also want to. I also want to. I know it's 8 o'clock, and I know we want to. I know Nikki usually does. I think it's maybe having a little trouble. Does until next Monday. I'll give mine. I got to run out and pick up a loved one from the airport. But until next Monday, really, I want us to focus on the 3 types of preventive health. Primary, everything we do to stay out of that system. I don't know which is hospitals, things like that we saw in COVID. We see with Serena, we just finished talking about maternal mortality and the difference. I think Dr. Taylor was on last week talking about it. Our community, our tribe doesn't fare well once we put our care in other people's hands, in other systems' hands, And while we work to move that system, the best thing we can do for our tribe is stay out of it. So do your primary prevention care, or as Mr. Harrington said, primordial prevention care, which is everything you're going to do, healthy nutrition, putting good things in your body, making sure you're exercising to stay out of the hospital. Start it there. Until next Monday, we're going to focus on that. Go see your primary care doctor that you trust, or as I call it, your healthcare bestie. Become health friends, and I'll see you next Monday. Nikki, are you back on? And okay, and then
I had a little tech problem, so thank you so much. Well, there's actually a constituent that's asking, Dr. Meyer, where are you located? Dr. Graham made a good point of having information available in junior high and high schools of how to develop relationships with primary care physicians. Could we incorporate this in some type of physical education curriculum? So I'm just going to ask if all of our doctors could just put in the chat where you are in case some of some of our constituents would like to schedule a non-emergency appointment with you. Great. There are so many comments, and we're having a hard time keeping up with them, but trust and believe we read all of your comments afterwards. And if there are questions, we make sure that we answer them at the next session. And
all right.
Our anonymous person says that they're just really sad over the AI and they're concerned about going back to the doctor. So we understand and we thank you for sharing. That would be a little concerning, but I Pete made some good points about that, and thank you for sharing. Thank you for sharing so much. As always, we talk about we are at that time, and I know you guys hate when we say that we are at that time. And I love the fact that we talked about the emergency room, because remember, COVID is living in the emergency room. So to try not to go to the emergency room. If you don't have to, go see your regular doctor. As our until next Mondays, thank you, Maya, for sharing yours. Well, Joe, your until next Monday. Oh, Joe, you're muted.
Mine is going to be quick. It's Hosea 4:6. My people are destroyed for lack of knowledge. Some people said we gave them knowledge. Go out and use it. Use whatever knowledge, whatever wisdom we may have shared, and some we may not have, but use it.
Outstanding. Thank you so much. So Joe says to use it because we perish for lack of knowledge. Well, Doug, you're until next Monday.
So I guess I want to address the issue of technology. I was a Sputnik kid. For those who are my generation, when the Russians had the satellite, all of a sudden the U.S. had to catch up. We had to get a man on the moon. I also grew up in Silicon Valley, so I've been surrounded by all this all my life. That doesn't necessarily mean that I'm an early adapter. But I do want to say that the advances in technology that we've had in medicine have really been able to improve our care. We're able to achieve outcomes that were just unbelievable 5, 10, 15, and 20 years ago. And so while I can understand that if you don't understand AI, it can be a very disturbing experience. So I want to tie in with Joseph Harrington. Knowledge will help you and be your guiding light in these sets of circumstances. So if you can learn about it, learn about how it can be used, and make sure it's used for you the right way.
Outstanding. So Doug says advances in technology have advanced our care. So learn how to use it the right way and make sure it's working for you. Joe said we perish from lack of knowledge. Well, Terry, Dr. Mason, what's your until next Monday?
I think that everyone should find the federally qualified health center nearest to them, because it can be one of those places where you can get a primary care doctor, where you can develop that relationships. And Congressman Davis has done a lot over the years to make certain that we expanded the numbers of federally qualified health centers. And this would be a way for you to have some place to go to before you have to, not saying don't go to the emergency room if it's a true emergency, but if it's just something that can be taken care of in a doctor's office, the federally qualified health center may be a good place. And maybe, Nikki, for those who don't know where they are, maybe we can direct, is there somewhere we might be able to put together to direct people to where the federally qualified health center is in their community?
Absolutely. I actually have a list of FQHCs that are inside the 7th Congressional District, and I will upload that list so they will be able to see them all. We do have a couple of our physicians here that are at our FQHCs, such as Dr. Thomas, who is at Howard Brown, and Maya, who is at Onyx. So we just want to make sure that people can see those FQHCs there, and they've placed their information in the chat information so people can grab that. Second Chance Kind of Love says this is empowering, and Natalie says, can we follow up on having a seat at the table in AI programming to eliminate implicit biases that can be built in? I think that is a awesome question. Thank you so very much. Well, Doug talked about we perish from lack of knowledge. Doug shared that advancements in technology has advanced our care, but make sure it's working right for us. Dr. Mason says to find the closest FQHC to you so you can get that BFF in your primary care physician. Well, Pete, what's your until next Monday?
Yeah, Nikki. I was just thinking about when we were doing Project Brotherhood, and which was a Black man's clinic that we had at Cook County many years ago. And one of the things that we did in the very, very beginning, even before the clinic started, was doing a focus group to find out what it is that the men wanted to see in a clinic. So I think we are going to need to, with all of the technology, we have to go back to ask the community, what do you want your healthcare to look like? And use that information to then put together a system that takes care of that community. And what I'm saying this is to say, I think sometimes, like the old people used to say, you get too big for your britches. It's like, okay, with all this technology, we still got to take care of Mrs. Jones and Mr. Jackson, and so we have to go back to them to say, what do you want your healthcare to look like? When do you want your clinic to start? What days do you want your clinic to be open? And so those are the things that we did with Project Brotherhood. I will say we're going to have to figure out how to develop a relationship with a primary care doc, because that person will be your advocate. It will be the go-between all of this complex information, including AI, and all this the BS that's happening all on the internet. People are talking crazy on the internet, all kind of stuff that people are hearing. I hear my patients coming in talking to me about something that they ought to do and not do. So you want a relationship with someone that can advocate for you and break down information for you and prevent you from having to go see Dr. Briggs, where the problem has escalated to the point where emergent care is needed, and of course the cost of that care is so much higher. So we have FQACs, we have people, and don't settle for one. If you have a PCP and it doesn't seem like it's quite connecting, it's okay. Just request another provider. We get that all the time, and it's not a big deal. We want our patients to be happy. I'm a medical director. I take complaints of my providers that people don't like for whatever reason, and I will, do my best to get them someone that they like. And so don't feel ashamed of having to see someone else. And I don't care if you see that person in the hallway or not. It's the deal is we're all about we exist here because of you. And if you stop coming, then guess what? We can't pay our bills, and then we can't exist anymore. So we want to make sure our patients are happy. So get your PCP, let that PCP navigate for you, advocate for you to help to interpret information to improve your health.
Outstanding, Pete. And Dr. Mason, your niece, Tamika Thomas, is here. And she says, Dr. Pete, you are right. She is jumping up and down. So she says, you are right. Jodine says it's nothing like the human spirit in healthcare. Outstanding. Well, there's one of the pastors here. He says, I know it's the end of the night, but please read my statement. So I'm going to read your statement, Pastor. And his statement says, I have nothing against AI and technology. He said, however, in healthcare, I still want to see a doctor. If we haven't learned anything, pay attention to what has recently happened within the last 6 months within our state. Several of our hospitals were crippled due to AI issues, and we couldn't access patients' records, phone records, and some of our hospitals did not even know how to go back to using a simple paper and pen. We should always have a backup system. One of our local hospitals had to actually go out and buy paper because they could not keep up with what was going on. Some of our major institutions all over TV, Children's Memorial, Northwestern, and so on, were crippled. Let's not be crippled by technology. And remember, someone is running it, but I still need to see a physician. Love the fact that you can run tests quicker, find some results, but I still need that human touch of a doctor to read it to me and guess along with me and understand me. I'm willing to work with it, but please don't replace it. And anytime it's coming this prevalent that I have to walk into the doctor and that's what greets me, I am afraid. Thank you so much for sharing, Pastor. I know it was going to be that long, but thank you for sharing. Thank you so much. Well, Joe started out with talking about we perish for lack of knowledge. And then, Doug said, let's use that technology and advance it and make sure that it's working for us. Dr. Mason wants you to find your closest FQHC and start that BFF relationship. Pete says, do what you want What do you want in your healthcare? Find what works best with you and your healthcare and what your healthcare should look like. Well, Dr. Briggs, you're until next Monday.
So Proverbs 4:7, and all thy getting, get an understanding.
All right,
I
Bishop, come on.
what I want to be sure the community and our tribe knows is you have to build a relationship with your providers, whether it's in the emergency room or whether it's in your primary care doctor. Those 5, 15, 20 minutes, however long that you were there, you have to also be responsible and in control and in that seat with the practitioner for your care. One of the comments that Nikki read about the person who experienced the AI and called the doctor and said that she was going to leave. I understand that. I I'm fearful though when you do that and you didn't have the conversation with the physician about why you were concerned and what your concerns were. That leaves an opening for you to keep that fear there when it could have been something that you may have liked or may have been more comfortable with had you had that conversation. So I don't want people to be afraid of the person that's taking care of them. That's not a good place to be. We are human. We are here to give you the information. We are here to help you with your health care. We are here to provide services. And we are here to be that bestie in health, especially in our community and our tribe. I love that Dr. Mason terms it that way. We are your healthcare besties, and we want you to use us as such. And as Dr. Pete said, if you're not comfortable, say something. It's okay. We know the fears in our community when it comes to healthcare. We're very well aware of them. We've experienced them. We do not find it, any harm to us when you say you want somebody else. We may not have the same communication lines, and that's okay. But you need to be comfortable enough to say that I don't understand this. AI is not something I want to do. And explain why, or at least get the understanding of what could work or what may be helpful. And it may not be the best thing for you, but let your physician know that. And that's on the primary care front. As far as the emergency room goes, we love to see you when you need to be there. We want to be sure. I love when my patients come in and they are supposed to be there because they didn't sit at the house and wait till something got worse. So I do not want anyone to take away from this, don't come to the ER. That's not what we're saying at all. What we're saying is to improve your health, to improve the outcomes, to start that preventive process so that you don't have to be in the ER. We want to encourage you to do that. So that's my takeaway.
Outstanding, outstanding. Well, Valdemir Talley says he loves the bestie framing, and Sandell Scott is here, and she says that I am watching. Just want to remind you guys, we did get a lot of your questions about TB and measles and COVID and RSV. We're going to touch on some of that on next week, but I am getting your questions and all the things that you have about that, and our doctors will be able to answer your questions that you do have. But just want to remind you that some of the things that you have sent questions about, they are airborne diseases, so your masks are still important. So if you have a mask and you're someplace and you just don't feel comfortable, just pop that mask on. It's all right. It's all right to do. Well, we talked about perishing for lack of knowledge, and Joe want to let you know that Mavis gave you a great amen for that. Doug talked about advancing with technology and making sure that it is working for you. Dr. Mason said to find your closest FQHC to get your BFF. Dr. Pete says, what do you want your healthcare to look like? You should customize it. And I like that. I like customized, tailored things. So customize and tailor your healthcare so it looks great for you. And then Dr. Briggs says, and all that getting to do what? Get an understanding and build those relationships. Well, Congressman, take us home.
Well, let me tell you, it's been a great and exciting conversation. And I certainly agree that each one of us have to take responsibility for our individual health. But I'm also reminded that in order to move systems and processes requires a great deal of unification. A lot of people don't associate the movement, Dr. King, and the marches and the demonstrations really moved health care in this country, the war on poverty, the initiation of programs, creating the structures through which people can work. I can and I want to thank both Dr. Pete and Dr. Mason for mentioning the role of federally qualified health centers. Um, I think of them, I started working with them when there were only 10 in this country. 3 of those were in Chicago. And of course, Near North was one of those 3. Miles Square was one of those 3. And there was one called the Martin Luther King that Access kind of followed it. And from those 10, there are now 1,400 serving more than 30 million low and moderate income people. And of course, we used to have trouble getting people to use them because many people thought they were just poverty program centers. And a lot of more middle class people were not attending or were not going. But when I think of a center like Miles Square that started in a 2-room house, a 2-room house, or I think of many of the others, PCC Wellness Care in Oak Park, Illinois, or Family Medical Center, or centers all over the country. Those are great assets that individuals can use and get not only service, but preventive health. The education is a big part of healthcare. So I just wanted to remember that and to remember that there are decisions coming up the rest of the year, and all of us have the opportunity to participate in deciding what kind of nation our nation is going to be. And if we get too carried away with what we've already done, we'll never realize how much there is to do. And so let us remember that. And we have in our own hand the opportunity to generate and create, organize as we participate. Thank you for the evening. Thank you for the knowledge. Thank you for the wisdom. Thank you for the discussion. And we look forward to seeing you next week. Thank you. Let's
Take
call.
care and good night. Just a few announcements. Don't forget to join us on Wednesday. And I'm sorry, that's Thursday, April 25th. The link has been posted on Facebook so you can join our national conversation on National Child Abuse Month. And it's a great conversation from raising awareness through the virtual movie of all you need to know about child welfare. Don't forget to meet us on Saturday at the By the Hands Club with another one of the Congressman's initiative on Minority Health Month, and it's the Queen's Initiative. And it's the conversation. All women 18 and over, you are please welcome to come. And it's Saturday, April 27th from noon to 5 p.m. at the By the Hands Club. And then also, there's going to be a May 18th event at Bill that the Congressman, along with a number of others, will be sponsoring. And it's a senior expo. So just want to remind you guys to come out. The Congressman Davis, HSI, and the Voice newspaper will be having a great, along with Miss Bernetta Howe Barrett and her agency, they'll be having a great senior expo. So I want to remind you guys to meet us at Bill. That's at 5100 West on Harrison on May 18th. So good night and see you later. Thank you so much for being here with us.